Hi guys, in this video series we're going to be going over is running injuries. It's going to be a three-part series. We're going to hit it joint by joint. We're going to go over the hip joint, we're going to go over the knee, and then we're going to go over the foot ankle. A lot of the running injuries I see in the office are actually caused from our pelvis. It's called pelvic unleveling. So when we're running, every step we take, usually our glute and our glute medius is strong and it helps to hold this hip up. But if it's weak and we have weakness in this hip or low back musculature, this hip's going to fall every time we take a step. It's not going to stay up nice and stable. And so this hip falls. And when that hip falls, because this is all kinetic chain, it causes our knee to go in and our foot to flatten out. In this video we're going to be going over is the knee injury section. Hi guys, we're going to go over a little general overview of the anatomy on the knee and the different conditions that affect the knee. And then we'll get a little bit into how we kind of treat a lot of these conditions. So like we said earlier, a lot of the stuff we see is caused by pelvic unleveling or weak hip muscles, causing that hip to rock in. And so when it rocks in, it causes this patella to come out and this foot arch falls. And every step we take, it's going in and in and in, causing this patella to come over. It's going to put uneven pressure on the knee and cause a variety of different conditions and irritations. So we can get this tight IT band over here, causing this patella to rock over. And so the patella normally sits right back in here in your trochlea of your knee. And it sits back in there and it slides nice and smoothly in there. But if this IT band it's being pulled to the side over here. This is actually this knee over here because we have the fibula. If this is actually being pulled to the side, it's not going to sit back there nice and smooth, and so it's going to start to rock. Every time we take a step, it's going to rock onto the femur in the back. And what you do is you start to irritate the cartilage on the back of this knee here, underneath it, and you get what they call chondromalacia patella. You can actually irritate the tendon down here, the patellar tendon, or actually it's patellar ligament because it connects a bone to a bone on the tibia here, what they call patellar tendonitis, okay? And then when this IT band gets tight, like I said, it's going to pull this patella over and it can cause inflammation right here. That's what we call IT band syndrome. So a lot of the biomechanics are altered, just like say a car goes out of alignment, it puts stress on different structures that aren't designed for that. They start to wear down and inflame and irritate it, scar tissue gets laid down, and eventually starts to degenerate if you don't address it. So the main goal is to do an assessment, figure out what's wrong, check the biomechanics. So we're going to decrease the inflammation in this joint, get these structures calmed down, but as well as, because it's a kinetic chain, we're going to address the foot, strengthen those structures, as well as the hip and the low back to help get the whole kinetic chain on either side stabilized. All right guys, now we're going to show a little demonstration of our treatment approach. We're going to check the osseous components first, then we're going to check the muscular components, and then musculature, and then the soft tissue components. So first we're going to check for joint range of motion here. She already has full joint range of motion. She's able to touch her knee to her butt here, so we have good range of motion. We're going to check the sponginess of this joint and the movement. See if there's any tibial rotation, see how the fibula is. We'll check the fibula first. We'll take out any tibial rotation we got on here. The tibia has a tendency to rotate in here. We're going to use our little speeder board here, which is just a motor force technique to help get that rotation out of that tibia. Then we'll go ahead and go through our soft tissue, which is our musculature. So first we'll check the external rotator. We'll check the piriformis over here. Check the piriformis. We'll check our gluteals. Loosen those up. We'll check our acetabulum in here. And now we're going to actually check the psoas, which is that hip flexor. And so your psoas muscle actually attaches onto your lumbar spine, psoas major minor, comes down, forms with your iliacus, which is right inside your iliac crest here. And they form this muscle that come down and attach onto your femur. It's actually the only muscle that attaches the spine to the lower extremity, and it helps to flex your hip. So if you have a lot of everything we do in life, we sit, we're hunched forward, tendency for that lumbar spine to flatten out, and a tendency for that hip flexor muscle to get tight, which is our psoas. And so we'll pin our hip flexor. I'll come over here so we can see. And so we'll pin our hip flexor. Molly's been here before, she knows about this. So we'll pin it straight. and back up. 19 band isn't too bad. I'm just gonna check some more range of motion on here. Excellent. All right. So we'll go ahead and lay on this side for me. We're gonna check the proximal and the distal end of each joint here. So we're going to check here is Molly. We're going to check her hip here. She's already an established patient, allowing us to show a little bit of her treatment protocol we got going on here. There we go. Other side for me. So take the rotation out of her hips here. There we go. On your back for me. We got that going on there. Check this here. Check her toes. Should do a little general overview on here. Check the tibialis anterior. Again, this video is just a general overview of how we treat this. Everybody's a little bit different, face down. We're going to assess your talus here. Which is a mortise joint. It's where your tibia and fibula come down and sit right on this joint back here. So we're going to check the subtalar joint. I'm going to have to block the camera a little bit over here. You're going to want to move over. Take out this. This is subtalar. Got the mortise joint here. Now we're going to scoop down just a hair more. Now we're going to go ahead and pin and stretch the calf musculature. We got your soleus and your gastrocnemius, which are the two main muscles in your calf. Come down and form a common area down here. Under your calcaneus, which forms your Achilles tendon here, which is another issue we're going to address in the other video when we hit ankle foot, the running issues. Because of that arch flattening, your overpronation, the arch flattening, causing your Achilles tendon to go in, causing irritation on the plantar fascia. But since it proximally attaches to the knee, we're going to go ahead and address that. So we'll do our pin and stretch on these. Pin and stretch. Excellent. We'll hold our leg there. We're going to hit hamstring. We're going to pin and go ahead and straighten your leg more. And back up. And pin and down. And back up. And pin. And down, and one more. And down. Okay, so check our range of motion here again. One ankle. Q1, not too bad. And check, make sure her legs are level. Alright. So the muscles look good. We're going to go ahead and check her fascia or soft tissue next to it. All right, now we're going to do our fascia. We're going to address Molly's fascia. We're going to do a whole nother video on fascia. So we're just going to use a little bit of lube here to avoid friction burn. We don't want to use too much because we want to get that nice, good shearing force to break up this fascia on her. So first we'll do some scanning, kind of see what we got going on. And here first. Change our directions. This fascia is a 3D matrix, so we want to make sure we get all the different aspects of it. Break some of that up. Alright, well, I'm going to go ahead and move your elbow up, or your ankle up and down nice and slow for me. So we want to hit it, the fascia, while it's moving too. You see we're getting some good irritation spots. Remember, the goal isn't to bruise the tissue, it's to break up the fascia, the scar tissue, the irregular capillary beds, and you get a little of that petechial hemorrhage. Alright, and now we're going to go push up. Now push into my hand. Now we're going to hit this with some resistance. Stop, get a little bit more lube on you. So I'll give you a brush burn. Alright, push again. Excellent. Feel that good grinding area. Relax. Just gonna go gently over the posterior aspect of the knee. And then again, as we'll see in the next video, we'll go over the foot a little bit more. We'll address the hamstring and obviously the hip. All right, now we flip Molly over. Now we're going to address the front aspect of the knee here. See what kind of fascial adhesions or anything we got going on in here. We'll go over the quad tendon here first. So what we got going on. Come over and check the IT. What kind of irritations we got in the IT, man? So the IT is a tendon, and so a lot of the current research shows that you could foam roll the crap out of this all day, every day, and you can't change the tensile strength. So if you want to change the tensile strength in the IT band, what do you have to do to release this tension? You're going to strengthen the other structures around it to help counteract that, to take the tension off the IT band. Okay. So we'll check her lateral joint line here. Yeah, it gets tender in here. Break up some of the scar tissue. Check your head of your fibula. This inserts under the tibia. Again, we've been treating Molly for a little bit. We're not going to see much stuff going on in here. If she was a new patient, it would probably be a lot more redness and irritation if this was one of her chief complaint areas. And then we're just going to have Molly straighten that line out. Check some aspects in here. We're going to get in here and kind of see if we have any irritations or inflammation area going on in here. Check to see if the patella is tracking properly. Move some of this around. Maybe hit some trigger points in your patellar tendon here. Yeah, a couple areas here. I'll break some of this up. Again, not too bad. Just assess that range of motion again. Now we're going to go over a couple exercises for Molly.